We decided to make this video about a physical exam in a rabbit so that owners could understand the importance of having an exam every year. A yearly exam with your bunny is extremely important. The first thing that I always do is weigh them. And this is Charlene. She's my recently adopted bunny. She's a mini Rex, and she is a slave to my other bunny at home, my boy bunny at home. And so what we always do is the first thing we do is weigh them. You will not know that if she's gained or lost 4 or 5 ounces, you're not going to be able to see that. You won't be able to tell, but 4 or 5 ounces in a little body like this is significant, especially as they get older. Charlene is probably 4 or 5, not sure. But she's a mini Rex and they have a tendency to gain weight. And unfortunately, she has gained a couple of ounces in my house, but she's still looking pretty slim. The next thing that we do is, or that I do, is that I examine their ears. Ears are extremely important because they tell me if there's wax accumulation, they tell me if there's any ear mites, anything that could be going on in the ear, any pus in their ear, which could be a problem. The most common thing that we find, especially in older bunnies, is that they accumulate a lot of wax in their ear. And that is because as they become older and arthritic, they can't get this back leg into the ear to clean out the wax. If I see one waxy ear and one that's clean, I know that the ear that contains the wax, it corresponds to the back leg that they can no longer use to clean the ear. So that's an obvious sign of arthritis. If they're ear mites, we treat them with Revolution. And if there's pus in the ear, we have to find the cause of the pus. The next thing that we do is we look at the eyes. I always pull out the lower eyelid like this because I want to see that she has nice pink conjunctiva. It's very difficult to notice whether a bunny is pale or not. They're really covered in fur all the time, and you can't open their mouths readily like you do in a cat or a dog to see if they're pink. So that gives me an idea of if they're pink or not. Looking inside the ear will tell me if they're pink. And one of the other areas that we look for to see if they're pale or if they're pink is their vulva, and it's nice and pink. If she were pale, this would be white. Okay, honey. Now the other thing we look at is nails. She's a mini Rex, and so their nails will always look long, but these are a perfect length for her. Normal other bunnies, if you look at our nail clipping video, you'll see that we ask you to clip to the edge of the fur. Because Rexes only have one layer of fur, their nails always look long, but you have to be really careful because her quick is right here. So if it got any shorter, it would really hurt and I'd make her bleed. The other thing that then we listen to is her heart. Unusual to hear heart murmurs in bunnies, but we have had 1 or 2 that have heart murmurs, and that's a clear indication of heart disease, cardiac disease. You want to hear a nice loud heartbeat. If it's muffled, you might be thinking thymoma, but there are other clinical signs that would indicate thymoma. Usually bunnies have a heart rate around 170, 180. So the next thing after we listen to her heart, we listen for gut sounds. If they come in healthy and the owner has no complaints, if I don't hear gut sounds, I'm not too concerned. Their stomach doesn't always have to be making noise. Their cecum does rest. So if I don't hear sounds coming from her cecum and she's doing well, I'm not too concerned. Right now, I'm not hearing anything from Charlene. Hold on a sec. Oh, she has some on this side. So that's okay. So after I listen to her stomach, I also feel her intestinal tract and her stomach. Now there's a video showing where the stomach is in location to their body. It's right behind the ribs, and here are her ribs, and right underneath is her stomach. So I'm feeling to see if she has food in there, and if it's nice and soft and pliable, which it is. And then I move further down her intestinal tract to check out her cecum and her kidneys. And you can feel these in a bunny. What's also extremely important, especially with her since she's a mini Rex, is to look at the bottoms of her feet. Charlene's feet aren't terrific. They're not horrible, but you can see a little bit of sore hock here. She's got a good callus, but it's a little pink. And so the same thing's happening on this side. And she is on a very soft carpet at home, but this is a bunny that doesn't have that second coat covering their feet. And if you don't keep them on the softest areas or area rugs, they will develop a callus on the bottom that's a little bit more dramatic than a regular bunny. The other thing that we look for also is that the urogenital area is clean, that there's no fecal material adhered to this, that there's no urine staining. Urine staining can be they're having a urinary issue. It can be because the litter pan isn't clean enough, and it could be because they're arthritic and they literally cannot lift their back legs up high enough and they're urinating on themselves. So looking at this area here is extremely important. And if they've got a lot of fecal material attached and it's soft, you have to start asking about the diet. Bunnies are immaculately clean all the time. They're like cats. And so if they're dirty, it's not their fault. There's something going wrong in their husbandry or in their diet. And then the last thing that we do is we look at their mouth, just because we need to take a look and see how their incisors are doing and see how their molars are. That's going to be really difficult to show on this video. But other than that, that's how we complete the physical exam, and we do the same thing for everybody. We recommend these yearly exams because as the bunnies get older, we can address their issues if they are caught early enough. At this point, she doesn't need any intervention. She's hopping well, she's eating well, but there will come a time where she may not be doing as well. She's becoming a little arthritic. Maybe she's not eating well enough, and we need to keep up with changes as she gets to be a little older. At 8, when your bunny reaches 8, we do routine blood work. Our bunnies are living longer than ever now. 10 to 12 is the norm, but somewhere around 8, we would like to do baseline blood work to have something to go with, because if they present in renal failure a year later, we know that it's only happened in that span of time, that we had a normal blood work when they were 8 and now they have a problem at 9. Once they reach 10 and a half, 11, we like to see them every 6 months, simply because we have to be hyper aware of weight loss and arthritis. Both of those sort of go hand in hand, because if a bunny's arthritic, he doesn't move, and if he doesn't move, he won't get to his food. So there's a lot of things that start happening, and they're all tied together. They're all interrelated. So I like to tell my clients that we like to see them and we age along with them and keep up with all the changes that they need as they get older.